everybody. We are the Sexual Health Group, and I'm Adam Murphy.
I'm Nick Cooper.
Alright, so imagine that you're back in the 5th grade, in a family life class. And then you've just gone through the whole scare tactic. They show you every single harmful picture of STDs that they can, just to scare you out of having sex. And then they decide to do this different activity that is designed to break down your self-esteem and think that you aren't worth it. Your teacher gets out a piece of tape. The teacher then goes around and decides to put it on different people's arms and say that every single time that this tape touches somebody else, that you are having sexual intercourse. And therefore it doesn't stick after the first time. And then it becomes a dirty piece of tape. The teacher then equates you as a person to the dirty piece of tape. Therefore saying that dirty pieces of tape are not wanted, and therefore not wanted by anybody else in society, and don't stick well with relationships. And then they go on to continue to judge you, because nobody wants to be a dirty piece of tape.
We all know that Louisville is the best city in the country, right? But we want to make sure that everyone else knows that too. We want to make sure that the statistics and the facts really match up to this. And the first step to this is making sure that our children of Louisville, get a basic education.
Currently in Kentucky, teen birth rates is 10 points above the national rate average. 1 in 4 teens contract sexual transmitted disease every year. 80% of curriculum supported by the National Center for Health and Human Services contain false, misleading, distorted information about reproductive health. In Kentucky, currently 37 out of 50 states who has a major increase in teen pregnancies. The Kentucky birth rate range around 13 to 20, which was overall 7,443 births since 2014. The reason being can be caused by a lack of sexual education. The Division of Women's Health is developing a strategy we plan to include public education to youth parents.
Our stakeholders, basically the people who are most affected by our policy, first of all, are the school board members. These are the people who really implement our policy recommendation, and they're really our biggest area. If they say no, that we can't go anywhere else. We have to keep going to the school board members to make sure that our policy recommendations are met. Next are educators. Now, as it is now, there are very little guidelines, very little. There's very little having to do with sex education that school board members put into place. And that kind of leeway can lead to very good educators and very bad educators. And when you have this kind of discrepancy, you can have very good behavior, but also just as easily, you can have very bad behavior to reflect bad education. That's why students are also some very big stakeholders of our policy. We want to be educated. We want to be educated on sex and STDs so we can actually know how to not be part of the statistics that have been really standing out as being 10 points above the national average in teen birth rates. The next, healthcare providers. What are these actually doing? Healthcare providers, when there is bad behavior linked to bad education, healthcare providers are the ones who take it as well. When the statistics reflect that, when statistics reflect high birth rates, high STD rates, health providers take it in because they have to put more into treating healthcare and to treat pregnant mothers.
Now, to fix all these issues, what we want to do is that we would like to have a policy to have medically accurate, non-coercive, and non-judgmental sex education throughout all schools throughout basic camps. Providing there's not a discrepancy between the different district schools, and therefore having an equal sex education between them all. This will be accomplished by providing a standard feedback education. The topics that will be included in the curriculum they would teach will be contraception, other relationships, HIV, AIDS, STIs, anatomy, sexuality, and consent. So then we can all provide a healthy and equal amount of non-judgmental education for all schools throughout the yes, so that every single person gets the same exact standard that they're supposed to have and that they deserve. Thank you all so